Welcome back. In Governor Walz's latest budget proposal, he's now recommending $16 million go towards HIV services. This comes after new federal funding changes cut these services from the Minnesota Department of Human Services. And the timing, well, it couldn't be worse. Sharon spoke with advocates about what they're doing to address the shortfall.
Right now, the Aliveness Project is working to mitigate a crisis within a crisis.
This is the first time in the history of Minnesota that the health department has declared an official HIV outbreak.
That was declared in 2020 with cases dating back to 2018. Matt Toburin, the executive director of Aliveness, says he's regretful knowing the tools are there, but the numbers have not caught up.
We have more HIV infections than San Francisco does. Minnesota is behind the curve when it comes to HIV care and prevention.
Toburin, along with other HIV/AIDS advocates and health providers, introduced a bill asking to ensure funding for this kind of work in the state.
Extremely frustrated, yet not surprised.
Mariah Wilberg also behind the bill. As someone who lives with HIV, Wilberg says she was devastated to hear about the potential cuts.
We're moving in the wrong direction. It's just perpetuating harm against our most vulnerable community members.
And by that she means folks living with HIV who aren't having their other needs met.
If you are unhoused, and don't know where you're going to sleep that night, HIV medications are not going to be at the top of that list.
With rates of 300 Minnesotans testing positive for HIV every year, both Toburin and Wilberg say the cuts couldn't come at a worse time.
And will send us in a completely wrong direction of increased HIV infections, increased need, and a lot of pain in the community that is unnecessary and shocking at a time when we have a $17 billion surplus.
Now, the Minnesota Department of Human Services told us the federal requirement will likely result in less funding being available for future programming overall. They say funding from HIV services comes from multiple channels, including the state legislature, and that they are relying on the governor's recommendation in his budget to help the situation.